Welcome, everyone, to Wellness Wednesdays with me, Dr. Deedra Mason, the Director of Clinical Education and Research for Market America and our professional division, nutraMetrix Custom Health Solutions. Today's discussion is about essential nutrients. Essential means your body can't make it, so you need to take it. There are so many nutrients out there that people believe that they're getting a sufficient amount to offset their lifestyle, poor sleep habits, lack of exercise, and even stress. They believe if they eat a diet based in color, that they're getting all of the essential nutrients that they need. The truth is, if your body can't synthesize it and you have the extra burden of toxins, extra burden of poor sleep habits, or even lack of exercise habits, what you may find yourself needing are more of these essential nutrients. We can't rely on the recommended daily intakes or RDAs for certain nutrients, especially the essential ones, and there's over 70 that your body needs every day. It's these nutrients that things like pharmaceuticals deplete. And so it's important to make sure that you're using a B complex, something that has the right formulation and the right ratio of these nutrients to one another. Something I see in the industry a lot is that there are people that will use a B complex and they'll refer to it as a B50 or a B100. This is where there's an equal amount of each one of the essential B vitamins in the complex. The issue here is that that's not how the body uses these nutrients. Nutrients need to be in the proper ratio to one another because the body will triage them. If you don't have the proper 1 to 2, 4 to 2 ratio of certain nutrients to each other, like we see with calcium and magnesium, to other essential minerals, then the body will hold up, wait to utilize that nutrient until there's a proper amount of the other. So it's important also when you're looking at formulations of the essential nutrients that you make sure that you're looking at a supplement line that offers you a nutrient or these essential nutrients in the right ratio or in the right milligram doses to each other. How do you know, right? Well, there are certain options that we have when we look at essential nutrients, in particular with calcium and magnesium. You may want to know that you should, if you want to make sure you're utilizing a mineral well, something that's essential to the body, that you take it more than just once a day. Many people feel like they want to get it all in at one time. It's easier that way, but that defeats the purpose. What you want to do with minerals, things like magnesium and calcium, things like your B complex, or even options like your vitamin C, is you want to take them in divided doses. So many times it's effective for you to look at a morning dose and then an afternoon or even evening amounts or evening doses. So if you're looking at taking products on an empty stomach, think about the evening dose being at least an hour away from food so that you can utilize these essential nutrients later on and not diminish your body's absorption of these by taking them all at once. That's one way for you to make sure that you're getting nutrients in the proper ratio. Also pay attention to the RDAs as a way to identify which nutrients you need to be taking in milligram doses and which you need to be taking in gram doses. If you look at the RDIs and RDAs, you'll get a better representation or a better education on the ratio of these nutrients, knowing that you need more B6 during the day than you do B2, that higher amounts of niacin are effective, especially when paired with a lower amount of riboflavin. By looking at the RDAs, you'll get a better sense, not just of divided doses and making sure that you absorb them well, but also the ratios that these types of nutrients should be in to be effective for you. And that's how you can choose a good supplement. You also want to look at other nutrients that go beyond minerals and vitamins that are also essential that your body cannot make. These are things like omega-3 fatty acids. Omega-3 fatty acids are essential to life. If you don't have them, your body cannot function the way it's supposed to. One factor that I think is important to pay attention to as you look at these essential nutrients isn't just the fact that they're depleted by things like pharmaceuticals or that they are depleted by activity or lack of activity, sleep or lack of sleep, and even some of our genetics. It's also important to pay attention to the fact that these nutrients, not only in a proper ratio, need to be taken in a proper ratio, but when we think about these essential nutrients, we find that we don't know what sources to get them from. And a lot of people believe with omega-3 fatty acids in particular that they're getting something when it just says omega-3, that they're getting exactly what their body needs to support neurologic function, cardiovascular function, and support healthy joint comfort. When in fact, what you need to be making sure of is the ratio or the amounts of those omega-3 fatty acids. That krill oil, flaxseed oil, fish oils in the form of EPA and DHA are not all the same things. Chemically, they're not the same things, and they'll be utilized in different areas of the body. So your best support when it comes to looking at things that are essential like omega-3 fatty acids is making sure that you're taking enough to offset your diet or your lifestyle, and that you're taking them in the right ratio. This usually means in a full spectrum, that you don't want to be getting too much of any one of them. And the purpose here is to not limit the absorption or utilization of another form of an omega-3 fatty acid. So ALA becomes EPA, becomes DHA. ALA in the form of flaxseed or krill oil can become EPA and DHA, but they don't do it in a rapid way or in a efficient way. What that means is that you should, in addition, if you want to take something like an ALA, omega-3 fatty acid, is that you want to take in addition to that cardioprotective, joint supporting, and neurologic support in the form of EPA and DHA. So very frequently when we have to make decisions about what we do from a supplement standpoint and from a diet standpoint, we have to make the decision to look full spectrum and look outside of just our dietary intake and think about how we can promote our health with the use of supplements as an adjunct to healthy dietary practices. Remember, when it comes to essential, if your body can't make it, you need to take it. It's essential for life. Your body cannot function the way it's supposed to without these essential nutrients. The limits to the body's metabolism come from having a sufficient amount on board. So if you're not sleeping well, you're not exercising well, or you take pharmaceutical medications, then one of the things that you will need are higher amounts of these nutrients. You won't go from breathing to not breathing. So we also want to be looking for kind of variations on the theme of deficiency or depletion. So if I tell you that omega-3 fatty acids are supportive of the nervous system, the brain and cognitive function, and you don't sleep well, that's going to limit your cognitive function, and it may be time to up the ante or commitment to supplementation. If you don't exercise well, there may be, or regularly, there may be issues associated with joint discomfort, and you may need to up the ante or your commitment to supplementation of these essential nutrients so that you can offset bad behavior, the best that we're able to do with dietary supplements, until you start consuming foods in their natural state in sufficient quantities and balance to each other. Now, that being said, we cannot escape our environment. By not being able to escape our environment, pollution, UV rays, and just the simple congestion and hyper kind of activity of the world, hyperstimulation of the world that we live in, it may be absolutely necessary for many of us if we want to maintain healthy aging, a better cosmetic appearance or presentation, healthy weight and body composition. It may be time to up our commitment to certain nutrients so that we can age, not just in a healthful way, but in a restorative way, and even stop the progression of some of the chronic health challenges that we appreciate may have something to do with advancing years. As you age, it may be important for you to consider increasing the amount of nutrients that you take to support healthy metabolic function when natural function has started to decline, where you were not as efficient as a fat burner as you once were, where you don't have the same kind of cognitive quick wit or being able to grab a word quickly, right? Those types of mental focus, concentration, and sense of overall balance can start to decline as we age, and it's during that time when we should get back to basics, copy nature, and start taking that which is essential. If you can't make it, you need to take it. If you have individual risk factors or burden in your life, you need to take more. If you're looking to take more, don't take equal amounts of more. Start paying attention to the way nutrients are ratioed to one another and make sure you're getting a balance of these essential nutrients, like vitamin C, like B vitamins, like selenium, and the minerals like calcium, magnesium, zinc, and the like. Think about trace minerals like chromium and vanadium, and then, of course, fish oils or omega-3 fatty acids. These are all essential, necessary for life, and your body can't make them, so you need to take them from a helpful supplement that's in a proper ratio or formulated with your metabolism in mind. My name is Dr. Deedra Mason. I'm the Director of Clinical Education and Research for the Professional Division of Market America nutraMetrix Custom Health Solutions. This was Wellness Wednesdays. Be sure to click on the on button if you like these topics and would like to see more topics from us on the nutraMetrix channel on meeton.com. Goodbye. Go be healthy. Go be brilliant. Okay, I've got a couple people in my waiting room. Not my waiting room, not my reception area. In my question waiting room. Let's answer your questions if you have them. Hi, Jane. Okay, thank you for clicking the on button that you like these webinars, or webisodes as I like to call them. No questions? Okay, you can always go back to these meet-ons, click on the comments, and we can see those comments and answer your questions there as well. Very good, everyone. Oh, there we go. We got a question. Hi. Maybe there's a delay because I said hi to you a minute ago, so maybe there's a delay. I'm going to wait a minute for questions. And I'm going to drink coffee. Perfect. Thank you, Jane. Look for an email from me later. I'm sending some things over. Okay, I don't think we're getting any more questions. So with that, I will bid you adieu.